Mr. Hern, you're recognized.
Thank you, Chairman. I really appreciate you doing this today, holding this meeting, and I appreciate all the witnesses being here as well. Post-acute care is an integral part of the healthcare system. It's where patients have the chance to really heal and get back home to resume their daily lives. One piece of this system is long-term care hospitals, also known as LTACs. LTACs were where the sickest patients go, as you all know, spending an average of about 26 days there. There are 2 LTACs in my district back in Oklahoma, 9 in the whole state of Oklahoma, and I'm concerned about the rate of closures we've been seeing in the LTAC industry in the past few years. While I applaud the work of Congress and what they did in 2013 to address overpayments and misaligned incentives in the LTAC system, we are now a decade out, and it's time to look how we can modernize and improve the work that was done. That's why, alongside my colleague across the aisle, Representative Boyle, introduced H.R. 1924, the Securing Access to Care for Seniors in Critical Condition Act of 2025. This bill ensures the sickest of patients are getting the care they need without unnecessary delays, and that LTACs are getting paid the appropriate amount for these patients by helping clarify what constitutes an LTAC payment. The goal of this legislation is to get patients the setting of care they need when we know they need it. Mrs. Graybear, thanks first of all for being back. I'm sure you're happy to be back in this room, and at least for a moment anyway, so thank you for all your work over the past under the former chairman. I know you have a lot of experience in this space, and can you tell us what Congress can do to ensure we get patients to the correct place of care, whether it be an LTAC, an IRF, or SNF, you gotta love the names, or any other place of care they need, as quickly as we can get their healing process started? And what are some of the unnecessary delays we are seeing in getting these patients to where they need to go?
Thank you for the question, Mr. Hern. And congratulations on the bill that you introduced just last week for regulatory relief for long-term care hospitals.
A bipartisan bill, I might add.
Yes, a very nice achievement. And it's a classic example of what I would classify as regulatory relief, the same type of policies I'm talking about that would be essential to pair with a unified post-acute care prospective payment system. So I do think those things could go together very nicely. And I think specifically long-term care hospitals could thrive under a revised payment system. So I encourage you to think about that type of reform and pairing that with the wonderful bill that you introduced last week.
Thank you much, Mr. Dongelli. I appreciate all the suggestions for improving the LTAC payment system, and that's why I've introduced my bill to provide a small bit of certainty for the industry. However, I want to ask you about the current statutory provision that specifically grandfathers just a few LTACs from some of changes that have happened over the last few decades. And do you believe that we should address these grandfather provisions as we look to modernize LTAC payments?
My understanding of the grandfathered hospitals, they have shrunk. I think there's 8 or less, maybe in the country right now. Those LTACs are not exempt from these payment requirements or the criteria for admission into the LTAC. They really center on the hospital within hospital provisions about common ownership and common control. So I don't think dealing with that would have any impact on allowing greater access into the long-term care hospital. One thing that I do think would allow greater access into the long-term hospital is dealing with this Medicare Advantage issue. And I'll use this patient example. We have 2 patients that look exactly alike, both on ventilators, both have stayed in an ICU for 3 days. One has Medicare Advantage, one has traditional fee-for-service Medicare. Our staff go in and evaluate those patients. The fee-for-service Medicare patient we can bring right in, no delay, because they meet the criteria that has been set by CMS, by Congress. The Medicare Advantage patient, we need to get prior authorization. We need to go through, they're usually denied because they say they can receive care in the short-term acute care hospital. They go through an appeal process. Now, you might say that impacts us, but think about that family. And we have often had this input coming from family members. They visit with each other. They're in the rooms right across from each other, and one will say, how come that patient can go to Madonna, but my family member can't? Well, it's because you have a Medicare Advantage plan, and they're delaying your admission, and they're denying it. So I think that is the key crux of what could happen short term to address this problem.
Thank you, and obviously pre-authorization is a whole other subject for another day, and
Yeah.
really appreciate your thoughts on that. Thank you so much. I yield back.